So the first reflection, I guess, for the World Public Health Nutrition Association is that we're actually here and we're having the meeting, and that we are able to do it in partnership with Abrasco, with the support of the university and then many of the other public organizations and partners, which has meant that we have not had any affected industry. So the whole ethos and philosophy of the approach and the way we've developed the Congress, the organization of the Congress, is unique. So to me, one success for us is actually, yes, we can organize a meeting like this. We can have a meeting based on values and principles, which is really driven by a Brazilian philosophy, actually. The way we got to consider what was in the Congress, there was a lot of discussion and debate, which I think is my reflection is it's a very Brazilian way. There's a very positive approach. Brazil is in a very important place in public health at the moment, perhaps unique in the world, doing fantastic things, better than anywhere else, I think. So for us, from the association, coming from outside Brazil, the fact of the Congress, the fact that we've got people together in the way we've got people together is in itself a success, irrespective of what has then subsequently happened. Then with the Congress being on, to me the success has been that we've actually made us think about what we're talking about with nutrition and public health nutrition, and that we're really seeing that we have to step back from thinking it's about just what you put in your mouth and nutrients and a sort of chemical approach, but it's actually more about food and where the food comes from and why people eat the way they do, and the social and the economic and the cultural and all of these big complex issues. But actually, if our approach is to have a sort of medical treatment approach, we know that doesn't work. So if we're trying to promote health, we're trying to keep people well, we're trying to prevent problems, we've got to really step back to the beginning to keep children growing up, to keep populations healthy, and to do that we really have to understand the wider environment in which people live their lives. So that's another, I think it's been very helpful for us to say, so if we're really going to do something about nutrition, we have to think about the social determinants, we have to think about inequity, we have to think about gender issues, we have to think about economic issues, we have to think about the environment. All of these things are important. And also I think, therefore, because there are many different stakeholders and organizations and departments involved in these things, it's very clear that nutrition isn't just a Ministry of Health issue. It's economic, it's finance, it's trade, it's education, it's agriculture. So one of the reflections is that it's very important for us to make sure we talk across these groups and that we understand where politicians are coming from, what the political drivers are for why we have food systems the way we do, and then understand how we can work through that, how we can work through environmental options, both in the wider sense of climate change, but also environmental options in the sense of how we can make it easy for people to be able to walk to work, to be more active in their daily life. So I think we're clear, we know some of the key things. We haven't been so clear about how those key things inform policy. So we are understanding better what shapes policy and how to bring those together to help the people with responsibility for policy to do that better. And then the last part of our knowledge policy action. So our whole vision has been to not just talk about what we know, but see, well, how can we apply what we know to actually solving problems, or if we think of solving problems as a negative, actually what we want to do is keep people well so that they don't have a problem, which it sounds simple, but actually if you think of most of how we deal with things in health, we wait until people have a problem and then we try to fix them up. So it's really quite a fundamental shift to say actually what's important is having children well and well in a social and cultural and physical sense. So the next thing is, well, what are we doing? Are we doing the right things? Are we doing the right things in the right ways with the right people? Are we engaging communities? Are we supporting and empowering people to have some control over their life? Are we looking at the things that are really making it harder or easier for people to do the things that will make them well and enjoy their lives? And then I think the other thing is, well, what can we as an organisation do to be more effective in enabling and addressing the challenges in an important way? So we have roles in arguing for the case about things, but we also have a role in developing a professional structure, because we know that in many situations a big challenge is that there aren't well-trained people in place to help make the decisions and argue for what is needed. So that's an important arm of our activity as well. The next Congress is going to be in Delhi in November 2016. So our challenge starting this afternoon is to see what commitments are we going to make, so that when we meet again in 4 years' time, we won't say, well, we'll be able to record the successes. We'll say, we made these commitments and this is what we've done to achieve them. So this afternoon, we're meeting to prioritise what we should be doing and then start work on how we actually address those. While it's still fresh in our minds, we're going to really try to nail those things down, and then over the next couple of months begin to develop groups or whatever it is that we need to do that. So we have about capacity maybe to do about 8 or 10 projects or activities.